The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hi, my name is Don McIntosh, and you're watching Health for a Lifetime. We're glad that you've joined us. Today we're going to be talking about something that's very important. It's sunlight. Do you get enough sunlight? What do you know about sunlight? Joining us to talk about this interesting subject is Dr. Tim Arnott. Dr. Arnott is a physician who's trained in family practice, family medicine, but also has really spent a lot of time in preventive medicine. He's a physician at the Lifestyle Center in Oklahoma. And Dr. Arnott, what do they do there at the Lifestyle Center?
Well, we take individuals, most oftenly they have diabetes type 2, or they might have heart disease, high blood pressure, maybe they're concerned about their weight, they may have arthritis, and they're looking for another answer. They're looking for a better option than what they've had in the past, and so they come to us, and we specialize in teaching individuals how to remove the cause, the underlying cause of their disease, so that these problems get better. And it's very exciting work. We see people get better. They lose weight. They're on less medicine. It's just exciting work.
Now, that's a beautiful facility. I've been out there. I've seen your facility. It's right there kind of on the top of a mountain there in the, I think it's the Arbuckle Mountain.
Arbuckle Mountains.
Arbuckle.
If you haven't been, you should be. Come see us.
Right there on the top of that, one of the big things I noticed is the sunlight.
Absolutely.
Maybe this is why you got interested in this subject.
You know, I think it's one of the reasons we're in Oklahoma, because we have so much sunlight.
Why is sunlight so important?
Well, you know, there's an epidemic in this country of weight in excess. We have 60% of the American population that's either overweight or obese, and that number is growing. And there's also an epidemic of depression in this country. And those two are interrelated. And if you're feeling down, if you're feeling discouraged, one of the ways you can pick yourself up is by eating. And individuals may not realize that we have turned in this country, in order to deal with depression, to medications. Medications that raise serotonin levels. And that's, of course, a neurotransmitter chemical in the brain that improves our mood, makes us feel better, improves our sense of well-being. Dr. Lambert and his colleagues at the Baker Heart Research Center in Australia have actually discovered something very interesting, and that is, if you get out into the sunlight on a bright day, you will actually raise your serotonin level 8 times higher than if you were standing out in a dull day. And so they've discovered, as we can go to our first graphic, it shows this quite graphically there. You can see what your serotonin production level would be. And it's very interesting. They actually took a catheter and they put it in the jugular vein that drains the brain, the blood coming right out of the brain.
Okay.
See, they've done studies.
So right in here. Okay.
Right in here. They've done studies where they take the blood out of the vein in your antecubital vein in your arm,
right here.
And they didn't see any major differences in serotonin levels between going out and being in a bright day and being out in a dull day. But when they measured the blood coming right out of the brain, they saw an 8-fold difference. Now, here's the point. Most of us spend nearly all of our time where?
Inside.
Inside. We're not even out on a dull day. We're inside in artificial lighting, which is about 100 to 250 lux, and it's 10,000 lux outside, and it could be a maximum of 100,000 lux on a bright day on a beach outside.
Lux is being, I guess, the
intensity of the light. And so we're in a dark environment basically most of our adult life, and our serotonin production is suppressed essentially chronically. They also discovered that the light intensity in the wintertime is not nearly what it is in the summer. And when they tested the serotonin levels between winter and summer light exposure, 7-fold greater serotonin production in your brain in the summer versus the winter.
So we should all move to Florida.
Well, we should get outside more. In fact, most individuals who are working probably have a 15-minute break sometime in their morning and sometime in their afternoon. And basically what you want to do is get outside and get the bright intensity light. Some people are worried about skin cancer. You really don't have to be concerned about that because this is light through the eye that's important.
Okay, so instead of having a Prozac attack, so to speak, even though there is a place for medication, I'm sure, with depression, maybe one of the best things you're saying, one of the reasons sunlight is important is because it can help us be less depressed, and it can help us have a sense of well-being as well. You know, what happens to the brain if I'm indoors almost all the time?
Well, I mean, it's just feeding off of this last issue. When you're indoors all of the time, your serotonin levels are going to be chronically suppressed. Your serotonin levels are going to be much lower, you know, maybe an eighth, maybe a seventh of what they could be, or even lower. And so your need for medication is going to be elevated. And there's going to be more people who are going to be, for example, SAD, which is seasonal affective disorder, which we usually think about as being up in the Northeast and those kind of states. But individuals who are depressed through the winter months. But this is something that is a major problem, more of a subclinical level. Maybe it's not being diagnosed, but many people are depressed in their mood because they're just not getting the sunlight that they need.
When's the best time to be outside?
Well, you know, studies have shown that the best time to be outside is first thing in the morning. What you want to do...
I think you have a graphic on this too, don't you?
Yeah, actually, we can go to a graphic. One of the best times to be outside is first thing in the morning.
Early in the morning.
Early in the morning, because one of the things that you want to do...
Because the sun's out, right?
Exactly. The sun is out, you know, and your body is actually has a circadian rhythm, and it takes cues from the sun in order to get that circadian rhythm.
So when it sees the
set.
sun, it says, time to be on the run.
Exactly.
Okay.
And one of the things that's important, you have a gland deep in the brain called the pineal gland. This gland makes the melatonin. Melatonin has important benefits as an antioxidant, but it also gives you that groggy, sleepy sensation that you want at night. But you don't want that during the day. You want to shut off melatonin during the day. And the way you shut it off is you get bright intensity light into your eye, and especially first thing in the morning.
On your graphic, there's probably another thing here as we're looking at that. What's the next thing? Spend more time outside.
Spend more time outside.
So just
that needs to be
gardening outside.
That needs to become a habit. Because the only way that you can get the intensity of light that you need to boost your serotonin level, and by the way, serotonin levels go up immediately as soon as you're out in that bright sunlight.
So immediately when you're out there, I mean, the benefits just begin right then.
Absolutely. And in fact, as our next graphic will show, if you're short on time, and if you don't have, you know, if you're a busy person working in an office, all you need to do is to go out when the sunlight is most intense.
Well, that's where people are worried. They say, hey, wait, if I go out when the sun is really intense, I'm going to get skin cancer.
But this is talking about light through the eyes. And you don't have to have light on the skin. You can have your hands covered, arms covered, legs covered, as long as your eyes are exposed to the bright intensity light there right around 10.
That doesn't mean look at the sun, though, right?
Oh, absolutely not.
Okay,
absolutely
it means
not.
just outside.
That's right, just outside, and your brain will actually be stimulated by the intensity of the light.
Can I raise brain serotonin levels without going outside?
Well, you know, there are some individuals who may not be able to get outside. You know, their job or their living situation may not permit it. And or in fact, they may live so far north that they're just not able to get the intensity, for example, in the wintertime, that they need. And what you can do is you can get a light box, and these are they're full spectrum lights, or they may actually be a blue light wave. And the blue light wave around the 400 nanometer wavelength is actually most effective at shutting off melatonin production. And so you only need about 20 or 30 minutes, about 2-3 feet away from a light box, and you can actually get the same benefits to the the brain as you would with the bright sunlight. It'll raise serotonin. It'll shut off melatonin.
Why would I want to shut off melatonin? I've heard that's good for you.
Well, during the day you want to shut it off, so at night you have a nice higher level, a higher amount of melatonin, so you're sleeping better and you have all of the good things that melatonin does at night. But during the day you want serotonin raised, and so you have the mood and elevating effects of that.
So do you have one of these lights? Do you look do you have to use this, or in Oklahoma you have enough sun?
Well, actually, I do have a light box that I do use because much of our work is indoors, and sometimes we're just not able to get outside. But it's actually probably helpful to do both because some days you may be able to get out, some days you may not be able to get out. But by and large, the very best way to get sunlight is just to sneak outside at every opportunity because there's fresh air out there as well.
So I have a friend that basically what he does right after lunch is he and his wife always go for a little brief walk right after lunch. It's probably the most intense time of sunlight, plus that he doesn't want to lay down after he eats, and he just goes out. Is that a good time?
Absolutely. Yeah, I think you're talking about Dr. George Guthrie. I've seen him out there after meals at the Lifestyle Center of America, going around the top of the hill, as you mentioned earlier. Lots of sunlight. That's an excellent thing to do. There was one of our coworkers, myself, and he actually did 15 minutes in the morning, 15 minutes in the afternoon. And I'll tell you, when you get done, that 15-minute walk out and you're looking up into the blue heavens and just walking outside, you will feel the surge of serotonin in your brain. You can actually feel the difference. It's amazing.
I feel like we should just go out right now. I mean, here we are with these lights all around us. Is this giving us serotonin? Is this helping us? Or these camera lights and all this
most
stuff?
lighting indoors is not nearly intense enough.
Okay.
Unless you buy a full spectrum light that's 10,000 lux, and that's within 2 feet, being 2 feet or 3 feet away from it, you're just not going to get the serotonin boost that you really need.
So pray for the people at 3ABN. They're not getting the light they need right there. They're sharing the light, but they're not getting enough of the physical light, perhaps.
It's a common problem, and all of us have to work on ways of getting out there because this is critical. We were made to be outside. The Creator designed us not only to eat a high-carbohydrate diet and fiber-rich diet, but also He designed us to be in the light.
Okay, we've been talking with Dr. Tim Arnott. We've been talking about sunlight. Let's summarize that just before we go to our break. What again have we learned? Let's just summarize briefly.
One of the most important things that we have learned is that many people are suffering from depression because they have depressed serotonin levels. And one of the major ways that you can raise serotonin 7-fold, 8-fold minimally is to get out in the bright sunlight.
We've been talking with Dr. Tim Arnott. He's a physician at the Lifestyle Center of America in Oklahoma. He helps people all day with different diseases, Western diseases, one of which is overweight and depression. We've talked about the connection between that and getting out in the sunlight. Well, if you can pop your head out for a couple seconds and come back in for the second half of the program, do that. We hope you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Tim Arnott. Dr. Arnott is a physician at the Lifestyle Center of America, and he helps people with, basically, doctor, getting over the common diseases that afflict Americans. We've talked about depression. We've talked about being overweight. We've talked about the importance of being out in the sun to address this and increase our serotonin levels and give us that sense of well-being and all those different things. We're looking a little more into that. We want to talk a little bit about the skin and sunlight. The question maybe we could ask is, what do green plants and children have in common and with the skin?
Well, you know, when we were living in Iowa, my wife and I had a small garden, and we were growing some corn. You know, Iowa is known for its tall corn. Well, our garden was actually shaded in part. About 50% of it was totally shaded, and then there was less and less shade. Well, we grew this corn, and you could actually see what corn was getting the most sunlight by how tall it was. And the corn that was shaded the most was very short. And one of the things, of course, that green plants need is they need the sunlight hitting those electrons there in the green pigment of the plant, creating energy for that plant so the plant can grow and develop and become tall. Children need calcium in order to build the strong bones, those long bones, the femur bone in the leg, that are actually going to help that child be nice and tall. The way the child gets that calcium into their body is through the assistance of a hormone, vitamin D. Vitamin D is actually a hormone that goes and it reaches the intestine of your body, and it stimulates the formation of a protein, and that protein reaches out and it binds to calcium in the food that you've just eaten and pulls it in. But if you don't have enough vitamin D, you're not going to make enough of that protein, and the calcium is going to go on past and out of your body rather than getting into the body. And so vitamin D becomes very important for growing children. And of course, vitamin D is made in the skin as light hits the skin, hits cholesterol in the skin, and changes it by a two-step process into vitamin D.
So just like those green plants didn't really grow if they didn't have sun, so your children really won't have the strong bones and won't really grow and have the calcium they need unless they're in the sun.
We have a resurgence of a disease in this country called rickets. Rickets is a disease of the bones of children. They don't form properly. They're deformed. And actually, the very first cesarean section was done, and it was developed because women had abnormally shaped pelvises because they weren't getting enough vitamin D, and so they had a form of rickets. And so they had these abnormal pelvises, and they had to do the first C-section or deliver a child through that abnormal bony structure. Well,
so the first C-section was done because there wasn't enough vitamin D.
That's exactly right. People weren't getting enough sunlight, and it's happening all over again today for a number of different reasons. But first of all, there is a resurgence of interest in vegetarianism, plant-based diets. Many people are reaching out for plant diets, and they're getting off of dairy products. Well, one of the major reasons we don't have D deficiency, vitamin D deficiency in this country, is because of the D in milk. So if you leave dairy products behind, but you don't pick up a source of vitamin D somewhere along the way, you can be putting your body at risk of vitamin D deficiency and your children at risk of rickets.
I can almost hear people right now turning their televisions off and going outside.
Exactly right.
But before you go outside, there's a couple other diseases we need to talk about. What are some other diseases that develop as a result of not having exposure? We've talked about rickets. We've talked about, you know, some of these problems. But are there other diseases that develop?
Absolutely. One of the major chronic afflictions of many individuals in this country is fibromyalgia. Now, fibromyalgia is a chronic disorder where the muscles are painful. There are actually specific painful trigger points. The muscles are tense. Usually these individuals are under a lot of stress. They're sedentary individuals. And it's a very difficult disease to treat. And even when you adopt an exercise program, which does help fibromyalgia, you have to be very careful that you don't overdo it. But one of the things that's been shown to help these individuals move away from their chronic pain and some of the muscle spasm is when they get their vitamin D level ups. A good number of these individuals, in fact a majority in some studies, have been shown to be vitamin D deficient. They're not bringing calcium into their body. And you may remember from your physiology that if you drop the calcium level too low in a muscle, that muscle actually goes into tetany. Well, you can have
just in other words, it just kind of seizes up.
Exactly, it kind of seizes up. And so they're discovering that when they take these women who are D deficient, who have fibromyalgia, and they replenish the vitamin D, that much of their symptoms are going away and improving. And so this is something that you may want to...
Do men get fibromyalgia as well?
I think that's true. Probably majority of women get it, but I think there's men that get it as well.
So for those men or women that are struggling with this, they've had that diagnosis, get outside.
Absolutely. Get outside and make sure that, again, it's recommended that you get about 15 minutes on your face, your hands, and your arms, at least 3 days a week, but that's just to avoid deficiency. That's not to get you to your optimal level.
You have a graphic to show us about osteoporosis as it relates to vitamin D deficiency,
That's
right?
correct. There were researchers who actually took women who were 85 years of age. These women were actually at high risk for osteoporosis and hip fractures, and they simply took one group and they put them on a double placebo.
Which is like a fake pill.
That's right.
It doesn't really do anything but the...
That's right. It looks like the study medicine, but it has nothing in it. And then they put the other group of women, and again, these were 85-year-old women. They were in the menopause, of course, so their bones were at risk. And they put them on 1,200 milligrams of calcium, and they put them on 800 international units of vitamin D. And they waited a few years, and lo and behold, they were able to cut the risk of these women having a hip fracture about 40% if they took the 1,200 milligrams of calcium and the 800 international units of vitamin D. And they were able to significantly reduce a hormone, which is parathyroid hormone. And that's a hormone which, frankly, if you don't get enough vitamin D, the body puts out that hormone to go to your bones and get the calcium, and uses the calcium from your bones to replenish the calcium level in your bloodstream. If you're not bringing it from the gut, the body will go to your bones to get it. It uses parathyroid hormone to do it. If you get enough vitamin D, then the body will settle down that parathyroid hormone.
Well, many times people that have these hip fractures, that's their last major injury because they go in the hospital, they never get out of the hospital.
That's exactly right.
So this is actually putting off their death, perhaps.
Absolutely. That's a very good point. In fact, I've seen it myself in treating patients who come in from the nursing home into the hospital with a hip fracture, and they never leave the hospital. Sometimes they're taking to a surgery. They have to have a hip pinning, and they don't survive the surgery because, you put the patient, an elderly patient, on anesthesia, the blood pressure drops, they can have a stroke. It's a serious situation.
So sunlight, very simple but very powerful.
Absolutely.
Something that all of us can really take advantage of, just getting out there, getting in the sun. What about the effect of having not enough sunlight and diabetes? I've heard that there's some relation between those two.
It was interesting to study the very important effects of vitamin D. Vitamin D, the major circulating form of vitamin D is what's called 25-hydroxyvitamin D. The active form is 1,25-dihydroxy. So it's a special formulation of vitamin D that actually does the vitamin D work in your body. And receptors, protein receptors for that active form of vitamin D are all over the body. They're in the brain, they're on the pancreas, they're on the beta cells of the pancreas, they're in the intestines, they're all through the body, and they're also on the white blood cells, the activated T cells, for example. And researchers have discovered that vitamin D is very important for modulating the immune system. If you don't have enough vitamin D in your body because you haven't been getting enough sunlight, your immune system will actually be hypersensitive. It will overreact to things that aren't enemy, but it treats them as though they were enemy. And so individuals who don't get enough vitamin D are higher risk for autoimmune diseases like type 1 diabetes.
And type 1 diabetes is caused because the body fights its own beta cells in the pancreas and kills them. And you're suggesting that if we get some sunlight, we won't, or perhaps those that would be set up for that might not develop.
You know, it's very interesting. Researchers have taken lab animals, and these lab animals are susceptible to type 1 diabetes, for example, or they're susceptible to rheumatoid arthritis. And they will go ahead, these animals will get those diseases because they've been genetically programmed to do so. But if they will give those lab animals that are susceptible to these autoimmune diseases, type 1 diabetes and rheumatoid arthritis, if they'll give them vitamin D, they won't get those diseases. And what they've discovered is vitamin D has a suppressing effect on the immune system, but it's not a suppressing effect that would lead you to get more infections. It just makes the immune system better able at determining what's friend and what's enemy, and so you don't destroy your own tissues.
You've convinced me. We've only got a couple minutes. Can sunlight help lower the risk of cancer?
That's absolutely right. In fact, what studies have shown is that individuals that have the highest vitamin D levels, and typically these are individuals who live closer to the equator. They have the lowest risk of colon cancer, prostate cancer, ovarian cancer, and breast cancer.
Can you get too much vitamin D?
Yes, you can get too much vitamin D, but only if you take it as a supplement.
Okay.
And you have to take about 10,000 international units of vitamin D every day in order to get toxic.
So how much vitamin D do we actually need? Let's look at that graphic in our last minute here.
Well, you know, there are a number of different authorities out there that have...
It says keep it above 30 to 40.
Yeah, that's the 25-hydroxy vitamin D level. And what we're actually finding out is that individuals who have a 25-hydroxy vitamin D level, that's the main circulating form, if it gets to about 40 to 50, certainly 30, but 40, 50 is even better, those individuals have the lowest risk of cancer, colon cancer, prostate cancer, breast cancer,
So we
ovarian
want it
cancer.
somewhere between 40 and 50.
That's correct.
And not above?
Not above 150.
Okay.
You can get up to about 100 without any trouble. The reference lab will take you up to about 70, and that's...
Can you get this test done somewhere? Your local doctor know how to do it?
Yes, yeah, it's available at any reference laboratory. Any standard laboratory will do a 25-hydroxy vitamin D level. My level was 15.
15?
That's correct.
Boy, I'm surprised you're alive today.
In fact, 3 doctors at the Lifestyle Center of America, one was 13, one was 15, and one was undetectable.
So you're seeing patients outside now there at the Lifestyle Center of America.
Yeah, well, we should be.
We've been talking with Dr. Tim Arnott. We've been talking about vitamin D. It's something you can get most effectively from the sun. If you don't know your level, if you have questions, why not get it checked? And we hope that as a result of increasing vitamin D in your life in proper ways, you can have health that is better and health that lasts for a lifetime. Thanks for joining us.